My name is Belinda Crouch and I work in the maternity unit at Rockhampton Hospital as the lactation consultant and also a clinical midwife. In this third session, congratulations, you have now had your baby and we are going to discuss feeding your baby, also normal baby behaviours and expectations when you go home from hospital. Throughout the entire world, including Australia and in central Queensland, hospitals have implemented BFHI, or baby-friendly health initiative steps to promote, protect and support breastfeeding in hospitals. The World Health Organization recommends exclusively breastfeeding or breast milk only in the first 6 months and to continue breastfeeding for up to 2 years and beyond. Queensland Health follows these recommendations, and at Central Queensland Hospital and Health Service hospitals, your infant feeding choices are supported, providing you all the information, assistance and support you will need, both antenatally and after you have your baby. Breast milk contains all the nutrients your baby needs for the first 6 months of life. When you are exclusively breastfeeding or giving breast milk only, no additional foods or fluids is necessary for the first 6 months, not even water. Breastfeeding has been proven by recent evidence-based research to enhance and promote your baby's vision, IQ or intelligence level, and speech development. Breastfeeding is environmentally friendly, produces no waste or pollution. It is totally free. It is so less expensive than buying feeding equipment and very convenient and can be done anywhere. Breastfeeding has large benefits in reducing the admissions of babies to hospitals and doctors' visits, as breastfed babies have reduced risk of infections. Some of these infections that breastfeeding can protect your baby from include vomiting and diarrhea infections, respiratory and ear infections, leukemia and even childhood cancers, some chronic diseases like diabetes, allergies and milk intolerances. It is very rare to have an allergy to breast milk. Breastfeeding was even added in 2012 to the SIDS, or Sudden Infant Death Syndrome guidelines, in the prevention of SIDS. With the worldwide pandemic of COVID-19 or coronavirus, there is recent evidence that there are COVID-19 antibodies present in breast milk when mothers are positive with the infection. So all of these different and large amounts of antibodies present in your breast milk, produced from you and passed into the breast milk, will prevent and help fight infections for your baby and increase your baby's immunity. There are lots of benefits of breastfeeding for mothers too. Breastfeeding causes the release of the hormone oxytocin, which helps feelings of love for your baby, but it also works on the uterus, contracting the uterus to control bleeding after childbirth. Breastfeeding may also help you to lose that extra weight gained during pregnancy. Breastfeeding is only 98% effective contraception, and only if you are exclusively breastfeeding over the entire 24-hour day. Breastfeeding at night time actually also helps suppress ovulation and reduces the chances of you falling pregnant, which is good to know. When breastfeeding, it is important to discuss with your GP at 6 weeks following birth your decision and choice for contraception. It is not recommended to commence contraception until 6 weeks when breastfeeding and lactation is fully established. You are a little bit more restricted with the types of contraception you can use when breastfeeding. Breastfeeding also reduces the risks of certain illnesses for mothers later in life, such as breast and ovarian cancer, type 2 diabetes, and osteoporosis, or low calcium in bones. So breastfeeding will even help you stay healthy later in life. When your baby is born, you will most likely be naked, or it will be facilitated immediately after the birth of your baby. Your beautiful, just born naked baby will then be placed directly onto your bare chest. A warm blanket will then be placed over your baby. Your baby remains in this position for the first hour following birth. This is referred to as skin-to-skin contact. Skin-to-skin contact in the first 60 minutes following birth will actually encourage the success and duration of your breastfeeding journey. Skin-to-skin contact is also done after cesareans, on the theatre table, and also in recovery. If there are no problems with the mother or baby, your baby will stay on your chest, skin to skin, when you are transported back to the ward from recovery. Skin-to-skin contact can also be done by fathers in certain circumstances, such as in a medical emergency where the mother is separated from her baby. Skin-to-skin contact is very valuable anytime postnatally. In this precious time, 60 to 90 minutes following birth, your baby displays innate and natural behaviours that they are searching, looking and wanting to breastfeed. They are smelling, licking and tasting and searching for the scent path towards your nipple. They will uncurl their fists and make grasping movements towards the nipple. They will show rooting behaviours, opening their mouth, turning their head towards the nipple, nuzzle their chin into the breast, and they may even crawl their way and find the nipple and breast on their own and self-attach. This is known as baby-led attachment. Your midwife after the birth of your baby may also help you with latching your baby to the breast. There are also many other benefits to skin-to-skin contact. For the baby, skin-to-skin contact can be used to help stabilise the baby's temperature. Rather than place small blankets over a cold baby or place the baby under a heater, it is more effective to do skin-to-skin contact and the baby will warm up very quickly. Skin-to-skin contact also helps to stabilise the baby's heart rate, breathing, and even blood sugar levels. In the special care nursery, we do skin-to-skin contact with our premature or sick babies. It is obvious that the closeness of the baby to their mother or father with skin-to-skin contact will definitely help reduce the baby's length of crying and help to settle your baby. It is recommended not to wash your breasts for the first 24 hours following birth, and your baby's bath will be delayed until after the first 24 hours. This delay of bathing the baby allows the familiar smell of amniotic fluid on the baby and on your breasts to help with the latch and success of breastfeeding. The early success of breastfeeding will help prevent problems such as sore, damaged nipples and engorgement problems. Also, skin-to-skin contact will again help with the release of that hormone oxytocin, which will help release the blood from the uterus after childbirth, as well as promote bonding with your baby. Most babies have a quiet, alert state for about the first 2 hours immediately after birth. This is the best time to initiate the first breastfeed. The next 20 hours after birth, the baby has a light and deep sleep pattern, and it is normal for your baby to feed only 3 or 4 times in the first 24 hours. After 20 to 24 hours, your baby may want to feed frequently. This is normal baby behaviour, and as your milk comes in, this will get better. You may be at home at this time too. On the second night after the birth of your baby may be unsettled and may want to feed quite frequently. This is normal and universal with all babies. It is not because you don't have enough breast milk or colostrum or your baby is starving. Your baby at this time just feels more comfortable staying close and snuggled close to you or snuggled at the breast. Just keep feeding and snuggling until your baby goes into a deep sleep. It does get better and you will get through this. It is so important for mothers planning to breastfeed to antenatal express colostrum from 36 weeks onwards in the pregnancy. Being able to hand express your breast milk is an important skill to learn for a number of reasons, and you most probably will need to do it at some stage after you have had your baby as well. Having antenatal expressed colostrum available following your baby's birth can prevent your baby being admitted to the special care nursery and separated from you, or requiring an intravenous drip, or having to have formula. However, everyone can antenatal express colostrum from 36 weeks onwards. The available antenatal expressed colostrum will most likely come in handy after you have had your baby. Your antenatal midwife will show you how to hand express and discuss antenatal expression of colostrum at 36 weeks. Don't hesitate to ask your midwife questions at your antenatal appointments, and make sure you feel confident how to hand express correctly and feel confident how to collect and store your colostrum. So how do you know when your baby needs to feed? Your baby will give you some signs or cues and will let you know. It is recommended to feed your baby on demand. Demand feeding simply means you feed your baby when they demand or want it. Your body will respond to your baby's demand and it will supply the breast milk required. We do not time the length of breastfeeds or when or how often they feed. Generally, the interval between feeds is referred to from the beginning of a feed to the start of the next feed. It is wise then to have a realistic expectation about disrupted sleep in those first 6 months. This is normal. So your sleeping 8 to 10 hours at night are over for a little while. There are many benefits of night feeds though. Apart from being required to keep your supply up with demand feeding, prolactin, which is the hormone responsible for producing milk, is at its highest at night time. So that will also help maintain and increase your breast milk supply. The feeding cues your baby will show are divided into early, middle, and late signs. It is best to respond to the early signs when your baby is starting to wake up, opening the eyes, bringing your hand to the mouth, starting to wiggle around, moving the head side to side, and making some gentle noises. When your baby is showing middle signs, your baby will start to fuss a bit more, getting louder with noises, even starting to cry, becoming more restless, like kicking the blankets off, or has the whole hand in his or her mouth. It may be more difficult to settle your baby to attempt breastfeeding. Your baby will be rooming in with you at the bedside in a cot on the ward as shown in the slide. This is also so you will be able to recognise your baby's feeding cues. The size of your breasts have no bearing on your ability to produce breast milk. Looking at this slide, the cross-section of a breast looks like a bunch of trees with tree trunks gathered together. The trees are the alveoli cells, which produce the breast milk, and the tree trunks are the milk ducts, which transport the breast milk to the nipple. The milk ducts are also hidden under the areola, or the large brown circle around the nipple. The nipple is just the outlet for the breast milk. In order for a baby to get breast milk from the breast, he or she must have a very wide mouth covering a large part of the areola and not just the nipple. Breasts start producing breast milk from around 16 weeks in the pregnancy. Some of you may be leaking colostrum now. Others may not be. This does not have any bearing on how much breast milk supply you will have once your baby is born. Every woman is different, and it is difficult to know until you have had your baby. So the first breast milk is known as colostrum, produced initially in very small volumes, which gradually increases in volume and is present until day 3 to day 5. It is yellow or clear in colour, very high in antibodies, high in sugar and protein, but small in quantity. Colostrum is only in small volumes because your baby only has a small stomach when born. On day 1, your baby's stomach is the size of a marble, like this one, or a cherry holding about 5 mils of colostrum. On day 3, it is now the size of a bounce ball, like this one, or a walnut in a shell, holding about 25 mils. Then on day 10, it is now the size of a golf ball, like this, or an apricot, holding about 45 to 60 mils. And at 1 month, as shown in the slide, the stomach is the size of an egg and holds up to 80 to 150 mils of breast milk at one time. So therefore, it is normal that babies may feed very frequently in the first few days due to their small stomachs. This is normal baby behaviour. After this time, your breast milk will come in from 3 to 5 days to about 14 days. This is referred to as transitional milk. It is lighter in colour and looks more like milk. When your breast milk is coming in, you may have some engorgement or firmness of your breasts, and you may need to hand express just a few mils prior to latching your baby to soften the areola, to physically be able to latch your baby and not cause any discomfort or damage to your nipples. This will settle down after a couple of days. Amazingly, throughout the rest of your entire breastfeeding journey, your breast milk will change in amount and ingredients from feed to feed, depending on what your baby's needs are, and your baby will let your body know what is exactly required each feed. After 14 days, your breast milk is now established and is mature milk. Mature breast milk is all your baby needs until 6 months of age and is a complete food. Nothing else is required for your baby. Breast milk is made and produced by demand and supply only. This means the more frequently and regularly the breast is stimulated by either breastfeeding or expressing, the more breast milk is produced, and breast milk supply is maintained. It is not produced or increased by drinking more water or what you eat. There is no need to avoid any particular foods while breastfeeding. It is about eating foods in moderation. There is little evidence that certain foods upset babies or give them colic or allergies. It is important and recommended to have a sensible, well-balanced diet, including protein, iron, calcium and vitamins. Drink 2 to 3 litres of water a day and limit amount of caffeine drinks like coffee, tea and cola drinks to 3 or less a day. Giving your baby a dummy and bottles can decrease or reduce this supply of breast milk, as the breasts may not be regularly stimulated enough to make the breast milk required. The use of dummies are not recommended in the first couple of weeks when breastfeeding is being established, especially if there are early breastfeeding challenges. Dummies may cause nipple confusion for the baby, particularly if the baby has problems with latching to the breast or sucking problems. The way babies suck using their jaw muscles and even their tongue action when breastfeeding is very different compared to using a dummy. It is important to establish breastfeeding first. There are also risks of infections with the use of dummies, such as ear infections and thrush for babies. Another concern is a dummy may be given to a baby instead of a breastfeed, slowing your baby's weight gain. Dummies are not provided for your baby while you are in hospital. When breastfeeding, it is important for mothers to position themselves comfortably, supporting the back, either in an upright chair or supported by pillows. Unwrap your baby prior to feeding and change the nappy if needed, and if your baby is not crying too much and showing the early or middle feeding signs. These 3 breastfeeding positions shown in the slide are the most common positions used for breastfeeding, particularly for feeding a newborn baby. The cradle position is fine for newborn babies who latch easily, or for experienced breastfeeding mothers and older babies. The cross-cradle position is ideal for learning breastfeeding or babies and mothers having difficulty with latching baby to the breast, or problems with babies not sustaining the latch onto the breast. Once your baby is latched and sucking well and with more confidence, you can then change the cross-cradle position to the cradle position. The football hold or underarm position is useful if you are feeding twins, have discomfort from a cesarean wound, or for ladies with larger breasts. There is no one right way for every mother and baby. The right way is what works for you and your baby. Although breastfeeding is natural, it is also a learned skill for both baby and mother. A baby attached well at the breast can prevent damaged nipples and help baby remove breast milk from the breast, and you will enjoy breastfeeding. It is important to make sure your baby is in the right position for breastfeeding, even before attempting to latch your baby. Now some tips to remember for correct positioning and attachment for a good deep latch. Turn your baby on the side with your baby's chest towards you, chest to chest. Head slightly tilted back at the same level as the breast, with your baby's chin touching your breast. Your baby's nose or top lip will be in line with the nipple. It is imperative not to touch the back of your baby's head all throughout latching or breastfeeding, but holding your baby's neck and shoulders when latching your baby. It is important to move your baby to the breast rather than breast to baby. When shaping your breast, it may be easier to use a C shape with your thumb and index or pointer finger under the areola, as shown in the slide, on the edge of the areola and away from the nipple. Compressing your fingers back towards your rib cage may help the shaping of the breast and even help protrude your nipple out a little bit more to help latch your baby with a deeper latch onto the breast. Gently touching your baby's mouth on the lower side of the areola under the nipple area, or touching your nipple onto your baby's bottom lip should encourage your baby to open the mouth wide. Then, with a firm movement, take your baby to the breast. Your baby's bottom lip will contact the areola first, well away from the nipple area, on the edge of the areola. As your baby's mouth then closes over the breast, a large mouthful of breast is taken in and covers a large area of the areola, achieving a deep latch. Your baby's top lip is placed near the upper edge of the areola. Make sure your baby has a good latch and is sucking well before releasing your hand, shaping the breast so your baby doesn't detach from the breast. Your baby is latched well, deeply and effectively on the breast when your baby's mouth is wide open, just like the picture in the slide with the tick on it. You can see both lips are flanged out, covering the whole areola, and more is covered on the area near the bottom lip. Your baby's chin is pressed into the breast and the nose is clear or only just touching the breast. When your baby is sucking, there will be a deep jaw movement, which you will see moving right up the jawline to the ear. And your baby's ear will wiggle too. Breastfeeding should not be painful. However, some mothers feel some slight discomfort and their baby more discomfort initially for the first 30 seconds of the latch, then a strong tugging feeling. You will even hear your baby swallowing. All babies during their breastfeeding journey have a suck, swallow and breathe pattern. They may do a few sucks, then swallow and then rest. With newborns, if that rest seems to take longer than 30 seconds and your baby looks sleepy, you may want to give a little prompt to remind your baby to suck by a gentle little prod with your finger under the chin, and you will find your baby will resume sucking. After the feed, the nipples should not be flattened, whitened or ridged. However, they may be slightly more elongated than before. If your baby is not correctly latched, you will need to detach your baby from the breast as shown in the slide by placing your finger in the side of your baby's mouth and detach from the breast. You will know when your baby has had enough when he or she spontaneously detaches from the breast or falls asleep at the breast. This is after your baby has had a reasonable long feed with good sucking throughout the breastfeed. Some babies will have both sides at each feed and some may not. In the early stages with a newborn, it is recommended to offer both sides each breastfeed. It is important to remember that the emptier the breast, the higher the fat content of the breast milk will be, which will help to settle your baby and help the growth of your baby. Like the pictures in the slide, which are very cute, your baby will show no further feeding cues or rooting behaviours. Burping your baby can be done between switching from one breast to the other and then after a feed is finished. Burping dispels the trapped air, or may be referred to as wind, in your baby's stomach. Some breastfed babies burp and some may not. It should only take a couple to a few minutes for your baby to burp if there is trapped air or wind present. If you then wrap your baby and place your baby in the cot, your baby will let you know if any more and further burping is required. Your baby will let you know when they are hungry and when they have had enough. Damaged, grazed, blistered and cracked nipples are certainly not normal with breastfeeding and is a sign that the latch is not quite right and the positioning and latching of your baby needs to be checked and corrected. It may be normal in the first few weeks for your nipples to be slightly tender. Some babies too, in the first 24 hours following birth, may not latch at the breast, which is not uncommon. This may be due to a baby being sleepy or have a weak or poor sucking ability. There are other ways we can or assist you to feed your baby in this situation. Your baby may be fed colostrum with a syringe or finger-fed colostrum, as shown in the slide, which is very similar to the same actions as breastfeeding. Also, your baby can drink from a small cup. These babies usually do better with breastfeeding in the following days. Most babies attach well and know what to do. Others may need a little more help with breastfeeding. There are always midwives to help you on the ward, and please don't hesitate to press the buzzer to ask for help. As the lactation consultant at Rockhampton Hospital, I am referred these babies and mothers with challenges or need more assistance to breastfeed. We don't expect a lot from our newborns in the first few days. As shown in the poster on the slide, your baby's output, or wheeze and poos, will change and increase each day until about day 5. This is normal and tells us a lot about how your baby is feeding. It is normal for your baby to lose weight after birth, but your baby should be back to their birth weight by 10 days to 2 weeks of age. Once your lactation and breastfeeding is established after 1 to 2 weeks, your breasts will soften and you may think there is not enough milk. However, you will continue to produce breast milk to meet your baby's needs. You may have up to 1,500 mils of breast milk in your breast in a 24-hour period. You will always have enough milk. All babies will have times in the first few weeks of fussing and wanting to breastfeed more frequently. This has been referred to in the past as growth spurts. This may occur at about 3 weeks, 6 weeks and 12 weeks of age, but could be at other times too. It only lasts a few days, and your baby usually, when next weighed, has an increase in weight gain more than usual. Your baby may also be clingy and want to breastfeed more frequently or cluster feed in the late afternoon or early evening. It is important to remember that there is always breast milk there, and it is not because you don't have enough breast milk. Your breasts are never totally empty. So maybe at this time, your baby just needs to fill up before sleeping for a longer period at night, or may suck for comfort, or be just tired. See if your partner can help with chores at this time, like preparing dinner, or you may want to try having your baby in a sling attached to your body and on your chest. There is always help and advice, and please seek advice if uncertain. If you are returning to work, it is possible to continue breastfeeding. Depending on your employer, there may be many choices for you. You may be able to have your baby brought to your work during breaks, or you may be able to express and store your breast milk at work. You will also need to purchase a good breast pump. There are many different types of pumps on the market at various prices. It may seem difficult at first, but the benefits are worth the initial effort, and you can still continue breastfeeding when you are at home. Breast milk is amazing. It can be stored in the refrigerator for 3 days, stored in the freezer for 3 months, and in a deep freezer for 6 to 12 months, without changing the nutrient content too much. All of this information is available in the Child Health Information Booklet in your baby's personal health record, which you will be given once your baby is born. Alcohol passes into your breast milk and to your baby. Even small amounts of alcohol in your breast milk may reduce your milk supply and possibly cause irritability, poor feeding, and sleep problems in your baby. It takes about 2 hours for the average woman to clear alcohol from her system from 1 standard drink, so then 4 hours for 2 drinks, and so on. You may need to express and discard your milk to maintain your supply and for comfort if you do consume these amounts of alcohol. Nicotine from smoking passes into breast milk. If you are smoking, it is recommended to smoke straight after a breastfeed and not smoke or have people smoke around your baby. Even clothes, hair and skin has cigarette smoke present on them after smoking, so you may need to change your clothes and wash your hands after a cigarette and before handling your baby. Illicit drugs such as amphetamines, ice, ecstasy, cocaine, heroin and marijuana all pass into breast milk and are not recommended with breastfeeding if continuing to use these drugs regularly. After 1 individual dose of one of these illicit drugs, breastfeeding would need to be avoided for 24 hours or longer, depending on the type of drug. Most prescription drugs, including antibiotics, can be taken when breastfeeding. However, it is important to check with your doctor or pharmacist and inform them that you are breastfeeding whilst taking prescribed medications. Partners and support persons play a huge role in the breastfeeding journey and the success and duration of breastfeeding. Partners especially are the most single influential factors affecting women who decide to breastfeed and continue to breastfeed. That is why it is important for partners and support persons to also know all of this information about breastfeeding and offer reassurance and positive reinforcement throughout the breastfeeding journey. Partners can be a great practical helping with babies' cares like changing nappies, burping and settling your baby, even at night time, guys. Also helping with chores around the house like washing up the dishes and vacuuming. This will allow mothers time to dedicate to breastfeeding, especially in those early few weeks of establishing breastfeeding and lactation. Consider how a baby in your home will change your lifestyle and your relationship. Babies are demanding, babies are noisy, messy, hard work, and won't sleep all night for a long while. Your life is about to change. Your life will change financially, practically, emotionally, and even your sexual relationship will change. You will be sleep deprived and very tired a lot of the time in the first few weeks. You may feel differently towards each other. You may feel angry and behave and react differently to your usual behaviour before having your baby. It is really important to talk and communicate to each other and help each other. You will get through this, and it will be worth remembering too, breastfeeding is giving your baby the best start in life for their future. There is support and help for you in the community with your breastfeeding journey. Your local hospitals are just a call away with a lactation consultant available for up to 6 weeks postnatal at Rockhampton Hospital. The Australian Breastfeeding Association, or ABA, offers a support service and network in the Central Queensland region. ABA has a great and informative website, as shown in the slide. This ABA website provides information fact sheets on many different breastfeeding topics. There is also a 24-hour helpline phone number, 1800 Mum to Mum, where you can speak directly with a breastfeeding counsellor. The Australian Breastfeeding Association provides regular group and social meetings with information on breastfeeding, general parenting topics, and also breastfeeding education classes in the community, with so many more benefits when joining up for membership with ABA. They are also on Facebook with the latest local event information and interesting updated breastfeeding and parenting information. Maternal and child health midwives and nurses are also available for breastfeeding support and follow-up when you are discharged from hospital with your baby. There are general practitioners and the Queensland Health 13 Health 24-hour phone service for further guidance and breastfeeding support. The Australian parenting website by the Raising Children Network, shown in the slide, has many helpful videos and information on breastfeeding. You are not alone, and there is always help available. Last but not least, enjoy your baby. Thank you.